I see. In the house, it is the one and only Tim Moore. Good morning, sir. How are you?
Good morning, Paul. I'm doing all right. And you?
First of all, I thank you because it was easy to say, no, I'm not available, and you decided to come in, so kudos to you, and I do appreciate it very much.
Paul, I've been straight up all along, so you know.
Yes, you have. Yes, you have, and I wouldn't say the same for Sam. Sam would have been on the lam, so it's a different world, and I do appreciate it, and I wanted to mention that to you.
Well, I appreciate it.
All right. The controversy, the kerfuffle, I like that. I like that better than fracas. Kerfuffle is just, we don't get to use that word, but you guys have now a kerfuffle. And yesterday afternoon, George Regional Health Center in Lucedale, Memorial in Gulfport, Singing River, Jackson, all sent similar letters to you terminating the membership of the organization. This is on the heels of UMMC. There are threats of others. The PAC donation to Presley of what has been quoted as 5 times the largest ever donation, stiffing all of the Republicans. Hospital have, well, I shouldn't say all of the Republicans, but some money was given to Delbert Hosemann. Hospitals have declined to comment beyond what was written in the letter. So, first of all, just to give you the chance to voice the overview and analysis of this, has what has been written, and most of this has been covered by the Magnolia Tribune, been accurate?
Well, Paul, that's a good question, and that, of course, comes from those facilities, so I can't really argue. I have to say it's the first I've heard of any of it. When we got the letter from UMC, I think it's kind of ironic that a public records request can be processed the same day the letter's written, even before I got it. So it's an interesting approach to what we're seeing here. It's concerning. It's disappointing that some of our hospitals have gone a different direction when all these folks have certainly been involved in the strategic planning of MHA.
Why have they done this? I mean,
well, you'll have to ask
first
them.
of all, but you're sitting in the catbird seat now. We both of us know that you know exactly what their disenchantment is, because the disenchantment is either, Tim, based on this PAC donation, and some are saying no, it's not all of that. It might be some of that. Some says it has nothing to do with that. Those are all innuendos. We haven't heard directly from them.
Sure.
I'm not sure where this soundbite is coming from. Can you hear that squeal?
I can.
I have no idea, and I'm not killing any animals. It's not me either. So it may be an audience member somewhere, or maybe it's another hospital.
Well, I hope not. Hope
all right,
good.
So just let you know it's no animals being killed here, so go ahead.
That's good. Paul, it's important, I think, that everybody understand the whole intent of the Hospital Association is to represent hospitals, and what makes it different from other advocacy agencies is we also bring the patient into that consideration. So everything that is done is for the benefit of hospitals and also for the patient. Each of these hospitals that have dropped out, they're still going to receive the benefits of anything that's accomplished by the agenda of MHA. So, if there's
what has that been? What are those accomplishments, though?
What is what now?
What are those accomplishments?
Oh, well, if you start looking at what we try to accomplish with our agenda, certainly the one and most important thing to all of our hospitals is Medicaid expansion.
Well, that hasn't been accomplished.
Not yet, but we're continuing to work on it.
Can you give me any accomplishment that the Hospital Association has had in the last 10 or 15 years?
Oh, my
goodness. As far as the association.
Absolutely. We have gotten tons of good legislation for hospitals, for patients. Mm-hmm. We have created a lot of different services and projects that have been in the benefit of hospitals and patients. I can give you a couple that, I know one of the things that you mentioned yesterday was the $11 million worth of revenue. And you said, oh, that's dues revenue. Well, no, it's not. It's not dues revenue. Only about $3.7 million of that was dollars that come from hospitals. The MHA is made up of a number of different corporations. Let me give you a couple of examples of those. Savio is a human resources suite of services that's provided not only to hospitals but to businesses in 41 states across the country. That generates revenue back to the hospital. We have IntelliTrue, which is an HIE that is providing real-time patient contact information. So we're able to move forward, and certainly the intent
you're saying that these are generating revenue above and beyond dues and things such as
absolutely.
that? Okay.
And we focus on that all the time.
How much of that has been given back to the hospitals, certainly the ones in need?
Well, now, what we do is that increases the dues.
Because according to this, according to this, you've got a larger percentage of money going to the cost to run the lobbying group in compensation and salaries than you do in grants.
Yeah. Well, but Paul, the compensation is all set up by a third party. There's, if you want to focus on me, there's 52 of us in the country, and there are salary surveys done, and that's done. And look, I can tell you, I've had opportunities to go to other states and make more money, and I have chosen Mississippi's my home. I believe in the hospitals here. I believe in the people here, and I've stayed here for that reason.
Yeah, Tim, and I said this yesterday. I don't envy you for you're making good money, and I think that's wonderful. I don't care how much you could be making $3 million. If that's what you're being paid, then congratulations to that. I have nothing to say about that one. Okay. The part is that there are a lot of people out there who think that the push for Medicaid expansion through lobbying has more to do with the revenue stream to the hospitals than it does for care of the patients, because we never have exactly what the aftermath of this is going to be as far as Medicaid expansion is. I don't think the Hospital Association has any surveys or any in-depth research that says what the good part of the bad part is going to be, other than we are providing a better revenue stream to the hospitals, to which, and I'll let you speak after this, to which one of the problems I've always had is even in the $103 million, we know that some of the hospitals are broken and they're not working, but we're going to throw this money at it, and it is a grant with no stipulations whatsoever. And if we do the Medicaid expansion, basically, isn't it the same thing?
Well, let's go back to the grant first. You do realize that's not an accurate statement. This money, no money has moved hands. Matter of fact, they're still going through the process. It is APRA money. So if a hospital does not have legitimate expenses that qualify under APRA, they're not going to get a dime. So now I know that's been misled, and I think their actual legislators have misled.
What makes you believe that they won't get that when they finish processing the necessary papers?
Well, because the hospital has to come up with legitimate expenses in 21 and 22 in order to get any money. Now, some of our larger hospitals, that won't be a problem. They'll come up with expenses. But some of the smaller hospitals that have not been able to do extra things, it's going to be more difficult for them to get that money.
Let me ask you this question. Go ahead. I'm sorry.
And some of the money actually will not even be appropriated until next year. And one of the legislators, actually one of the senators, shared with me. He said, "Look," he said, "I'm bothered by this." He said, "We tried to do something good, and when it became time to make it operationalized, it was not what we thought it was." And that's just what's happened. So the urgent need for hospitals to get money, and we appreciate it. Listen, don't take any of this as we're not appreciative of what they're getting, because they need it. Desperately, they need it. They needed it a month ago. But it's going to take longer than that to get it.
The problem is, do you think all of the hospitals have the same problem out there, and Medicaid expansion would help that problem? That's the only problem they have?
No, it's not the only problem they have. Revenue is a problem in the state of Mississippi.
Well, isn't it the crux of the problem from a lot of people who have a genuine disapproval in here of this is because we haven't defined what the problems are that are closing these hospitals? Because I think all of us understand it's a cultural change, socioeconomics play into it, hometowns have changed and everything else. And when you say that Medicaid expansion is going to help it, but again, we look at it and say this, and I've had people tell me this. By the way, we're not talking about Medicaid expansion is not talking about the people who are on Medicaid now.
That's correct.
Because that Medicaid roll continues to grow, does it not? Just in the defined classification as you have it.
It has, but you're looking at about 100 to even 150,000 about to roll off of that because of the CARES.
But that's because it was redefined during the pandemic.
That's correct. They
could
not come off the roll.
If you're on the original thing as far as Medicaid's concerned, then you're still okay.
That's correct.
You're still in the poverty group. You haven't changed. Your health hasn't changed.
You can't work. That's right.
But It is also said with this new group of people who are making more, but they would qualify, like the ones that are going to be expired on this one, that every time that happens, somebody who is above that group, who's still struggling, but they're making too much to get Medicaid, if they cancel Blue Cross, chances are their premium is going to come up, the people who continue to have Blue Cross. Now, can you say that absolutely categorically is false?
I can say that's somewhat misrepresented because
all right, we'll talk
gap.
about it when we come back.
Okay.
All right, let me get back with Tim Moore. Tim is President and CEO of Mississippi Hospital Association. So when we get back to that, I have heard numerous times that if some people in the expanded insurance pool that currently have Blue Cross Blue Shield, they cancel because they're going on free health care from the taxpayers of the state on Medicaid expansion, then ultimately that means the people who are left on Blue Cross Blue Shield will ultimately see, because of just mathematics, a rate increase sooner or later. So we pay in more ways than one with the people who do have insurance.
Yeah, and of course, what was going at too was the gap between the Medicaid population that's covered, and then there's an exchange population that's well above that, above the 138%. And then you get into the Blue Crosses and the commercial plans that are out there. So if you back up to that 100 to 138%, that's a population that is typically working multiple jobs. Their employers do not provide a commercial plan for them, and they cannot afford to do it. I mean, it becomes an expendable income issue that they cannot afford that health care insurance. So there is a gap. Now, you mentioned a while ago it just benefits the hospitals. Well, that's not true. These people are not making it to get health care early, so their problems exacerbate and they get worse. You know, we've used the example of a diabetic that goes untreated for a while. They get an ulcer on their foot, and then eventually they have that foot amputated. Well, all of a sudden, that patient moved from being a part of that expansion population to an SSI, full-time Medicaid patient that you got for life. That's going to cost the taxpayers a lot of money. Now, if you go back the other way, the cheapest, most inexpensive health care we can provide is preventive care. So if we are able to take care of that population in the middle that currently, when they get sick enough they have to come to the hospital, is costing our hospitals over $600 million a year. In most states, and you know, talk about the data of being able to support this, look at all the other states. Watch Alabama. They're going to pass it this year. It'll go through in Alabama this year. South Carolina did. South Dakota did. North Carolina, not South Carolina. North Carolina. And they're showing evidence of a lot of improvements in health outcomes. They're certainly showing improvements in the financial viability of their hospitals. And that's where we are, Paul. This is a win-win for everybody. It's an economic booster.
See, there's another problem I have here.
Okay.
When you look at how long we've had Medicaid in the state of Mississippi, we haven't. I don't see the outcomes there as far as with the amount of money. When you start, we're still as everything we ever read as far as low birth rates, infant mortality, diabetes, overweight. I could go on and on and on, and none of it's getting any better. We are just babysitting this, and we cultivate that, but nowhere is you come back and you say, okay, we've had this program for 15 years or for 5 decades, and it's any better. What leads us to believe, the people who are paying for our insurance out there, the taxpayers, to believe that this is going to be something that's going to make health care better in the state?
Sure.
I mean, it's a viable question.
Yeah, great question. I love it. That's a really good question. And this is where another misconception comes into play. We keep taking this population, the expansion population, and calling them Medicaid because that's who pays the bill. Now, there is a Medicaid population that you just identified a minute ago, and that is a sicker population. They're sicker. They don't have the income to afford anything else, so they're that Medicaid population. They've got problems that they're not going to be able to work. They're not going to get better. So you're taking a sick population to start with. Now, let's jump over to the expansion.
These are the ones who are going to the hospital, though, aren't they, and causing the indigent costs?
No. Those are ones that you're getting Medicaid check for. You're getting paid. Now, let's jump over to the expansion population of those folks that can't, that can't afford insurance. That's a population that wants to work.
All right.
They want to stay healthy. You know, if we had back when the Accountable Care Act came into play, if we'd have put it anywhere but under Medicaid, every state in the country would have accepted it.
I do want to, because we've kind of diverted on the Medicaid expansion, and everybody believes that's why you poured $245,000 into the campaign for Brandon Presley. What makes you believe that the House and Senate will acquiesce to this? Because without the House and Senate, Brandon Presley cannot do anything on his own, even if he called a special session.
Sure. Well, you got the state of Mississippi. All the polls show. As a matter of fact, anywhere from 75 to 80% of the population of Mississippi wants to expand Medicaid. Every poll I've seen. So, nobody can tell me anymore Mississippi doesn't want to do it. There may be small groups here and there, but anywhere from 75 to 80% of every poll you see in the state of Mississippi wants to expand Medicaid.
No, I haven't seen those polls.
You mentioned, we can send them to you because they're all over the place.
Yeah.
Look back at the past 4 years ago. Mm-hmm. 4 years ago, we supported Bill Waller, we supported Robert Foster, and we supported Jim Hood. What's common? You got 2 Republicans and 1 Democrat. Okay. All of them supported a health care platform.
Tim, you don't think after you just got a check for a hospital association, just got a check for $103 million from a supermajority House of Republicans and Senate?
We hadn't got that.
Well, it's in the works. It's gone a lot farther than talk now. It's a signed bill. So, and by a Republican governor, don't you think it was kind of a slap in the face to do that?
Not intended to be. All it is it's not Republican or Democrat. It's what are you going to support? Are you going to support hospitals and health care or not?
All right. But so you're saying you think this withdrawal from hospitals now 4 and maybe more by the end of the week, leaving the hospital association, is primarily for this reason? For the contribution?
Like I said, Paul, you're going to have to ask them that.
Well,
I would assume
we can ask them.
That's the only thing that has changed. Okay?
But here's
what
they
hasn't
say.
changed. It's the same proposal we've done year after year after year.
But they say that's not it. They say this action is the result of realization that the Mississippi Hospital Association's current leadership, that's you, sir, is no longer able to effectively and productively represent George Regional Medical Center's interest in various meaningful areas, and in fact has become counterproductive. That is that's a cherry bomb right there as far as your leadership is concerned.
Well, I happen to have that letter right here too, and there's a misprint in that letter, and it says Mississippi Hospital Association current leadership strategy is no longer. Okay, and I even called the administrator to confirm that. I don't know why somebody that did that reporting did not accurately pick that up. So
well,
I got the letter. I got the letter right here. I'll see if
I believe you. But how do you separate the strategy from your leadership?
Well, Paul, we're like any other organization. We've got a board that represents us, elected by the membership. Mm-hmm. They give me a direction to go. They give me policy, and they ask me to implement it. And that's what I do. And if somebody pulls away from that, I can't take that personal because I'm doing everything I can for every hospital out there, and I'll continue to do that if they're a member or not. I'm still going to support hospitals.
Tim, what other things are they disenchanted with? Because I think you've got to have some idea.
No, I have not been told anything, Paul.
Nobody tells you from the board. Nobody tells you from the hospitals at all exactly what they are disenchanted with.
Actually, some of these letters I didn't even get first. They were in the media before I got them. So that looks real odd, doesn't it, Paul?
Well, no, not the letter, but I mean, prior to that, during the meetings and everything else, you, as the head of the association, president and CEO, there's not been some feedback where we're discontented with that. It's come down to the cancellation of the association itself,
and it would have been great
before you know exactly what they're disenchanted with.
It would have been great to have some conversations like that, to sit down and let's talk about it and let's resolve the issues. Matter of fact, we've got a board meeting coming up tomorrow that we're going to talk about those things. How do we resolve this? Let's get to the real issue of what needs to be addressed, because the association has done nothing but stay the plan that we have always had. Even the individuals that hospitals that have dropped out were part of that strategic planning process.
Do you think that they were disenchanted with the hospital association using its power to try to, as far as the initiative is concerned? Trying to push for the initiative, push for a bill that would appear on the initiative to force in the Constitution the Medicaid expansion.
Not that I'm aware of. They've all been supportive of that.
You have $27.4 million in assets. Is that accurate?
That'll be pretty close. And Paul, think about this. The Hospital Association has been around for 92 years.
No.
Any corporation is going to acquire assets as they go along. And,
but I think the question
it's
that
for
I got,
other businesses. Remember now, this is not just an advocacy organization.
And you can answer this when we come back on the final segment.
Sure.
A couple of questions that I got on C-Spire was, if you've got that kind of money in assets, not in assets, but a cash on hand, what was the cash on hand? How much? 11.3?
No, not
million?
cash on. That's going to be that was income. I think cash on hand is probably somewhere between $2 and $3 million.
$2 and $3 million. But you had of the 11.3 million in revenue, you had 3.1 million in grants.
Mm-hmm.
Is that up or down, or is that about normal?
Well, that grant program has actually gone away. That was a program that was set in place years ago. And,
so you don't have that one.
That's not there anymore. So that
I'll give you final,
and that revenue is not associated with that anymore either.
All right, I'll give you final thoughts when we come back.
Yes, sir.
The Trustmark Studios on the SuperTalk Network, and we thank you. And again, we thank Tim Moore for coming in. Tim, it's a little bit like the medical marijuana narrative that we've had, excuse me, for so long, where the narrative is not about the passage. That's done. The narrative now for the lawmakers who voted on this, whether Republican or Democrat, is going to be the aftermath, which is going to be not so much about patient satisfaction, but it's going to be about the arrest, the culture change, the degradation in our society, hometowns, abuse, overdoses, all of that, and that's going to be on every single time it happens. It's going to be on the people who voted on this one. In states where they've done this, the same thing is the similarity, where after the passage, it's not going to be about that narrative anymore. It's going to be about the exploding projections that they thought were going to come on. They've exploded to well beyond the number, not 200,000, but maybe 300,000, 400,000. There's no cap on that one. And that's what we see in some of these other states also. Being that we carry a larger percentage of poor folks than anybody else, that could have a major effect on our budget here and our revenue.
Well, let's look at what's
happened.
happened.
And the lawmakers are going to have to answer for that if they voted for it.
Sure. Well, let's look at what happened during the pandemic. With those additional people that were added to the Medicaid rolls and the increased funding that came from the federal government, Medicaid actually made money.
Why are the hospitals enjoying that?
It's not going to the hospitals, but there is a surplus at Medicaid. Okay? Hospitals get paid.
Has the formula changed in the projections if it's expanded?
It's because of an increase in the FMAP, which you get with when you do Medicaid expansion, you get 90-10, okay? And it was 84 something odd there, but it was enough that it showed you that it is an income generator for the state at that time. That's what all the economists have said. If you look at the growing rolls, let's take Louisiana, for example. Mm-hmm. Louisiana taking a number of the expectant mothers that also qualified for the expansion model. They moved them over there intentionally. The state did it because they got a higher match. It worked better for the state. So all these numbers that get blown up, some of them are being done by the state. Paul, there's not a single state that has stopped Medicaid expansion. They can't. Well, it's too much of an economic benefit to them.
Well, it's also a political bomb if you start pulling. Look at what we're talking about here. It's a political bomb when you start taking stuff away that was free.
But it's an economic benefit to the state.
All right.
You just look at the numbers. They're out there.
Could I ask you this? Is the Hospital Association in favor of dropping the CON Certificate of Need?
That's a whole other discussion.
Well, I mean, it's yes or no. Are they in favor?
No. In general, in general, they would not. Are they willing to sit down and talk about how it could be modified? Absolutely. Remember, the CON process was not put in place by hospitals. It was put in place by the federal government.
I didn't ask that, but I'm talking about today, not what happened.
Yeah. But you need to know how it got there.
Well, it really doesn't matter.
Well, it might.
Well, it really doesn't matter. The fact is that right now the Hospital Association doesn't want any competition.
That's not true.
Well,
that's not true.
What would it do?
Paul, listen. You've got EMTALA, okay, that hospitals have to apply by. So if you come into the emergency room and you're evaluated and you have a life-threatening emergency, then you have to be treated, period. You don't get to pick and choose.
We're not talking about that. We're talking about ambulatory services, which are a revenue generator from some hospitals.
That's exactly what we're talking about.
Even
those
hospitals
that actually generate money.
Even some of the hospitals that don't offer those, they don't want it to be in that city.
Well, listen, Paul. If you continue, if you want to make government-supported health care even more expensive, continue to take things out of the hospital that generates some profit for them. If you take all the Blue Cross patients out of the hospital, then all you got left is Medicare, Medicaid, and other federal payers, and that's what you're going to get. So the government's going to have to subsidize that. There's no way, because you don't cover the cost in them. You have to understand that.
But some of what is happening it's not government pulling their business away. It's culture. It's the change in the hospitals and the communities. It's not the government pulling that away.
Well, I didn't say anything about the government pulling it away.
All right. Your final thoughts,
I said that you've created a process out here where a business can start up and pick and choose what patients they serve. That's fine. But you're taking them out of a hospital that has to provide those services in order to make the ends meet, and that's not happening now. So.
There is a convoluted math going on within the healthcare system, as you well know, and it starts in Washington, D.C., and I think both of us have talked about it. Sure. You guys have to play under that regime, and it's not easy.
Right. Paul, let me mention one thing. Yes, sir, and I appreciate that. You mentioned, I think it was said yesterday, about the AHA was pulled in on the percentage of Democratic contributions they made. Well, if you look at the contributions in the state of Mississippi, over 70% of contributions were made to Republicans last year by MHA, PAC. So this is not a Democrat-Republican thing. This is a policy issue. We're trying to stay focused on
your task is this, to go out and find out why they're really mad at you.
Who else is mad at me?
Well, apparently,
I've gone a long time and not had anybody mad at me. So I guess
a lot of people at the hospitals because they're canceling, and you've got to stop that bleeding. So.
The good thing, Paul, is the calls that I've gotten to say, stay on course. Right. You're doing the right thing. You're trying to support hospitals. It's sad that
we only got a few seconds. Okay. I appreciate you, sir. We'll get you back on.
All right, Paul. Appreciate you.
Bye.
Take care. Bye.